If you use medications to band-aid things, then you're reacting like you said, but you're not fixing the underlying reasons why these things happened in the first place. So the real reason why, high cholesterol is happening or inflammation's happening or whatever isn't being addressed, whether it's hormones, whether it's gut, it's probably a combination of both. We talk about things that are layering up to fill up your bucket. It's not going to be one thing that we're magically going to do. And that's why it's so important to find somebody who addresses all of these things.
Welcome to this episode of Explant Surgery and Recovery with Dr. Robert Whitfield. Today I'm interviewing Dr. Aimee Duffy. She is a board-certified physician and founder of Carolina Integrative Medicine, specializing in functional and integrative healthcare. With over 20 years of medical experience, Dr. Duffy is dedicated to empowering individuals to regain their vitality and wellness by addressing the root causes of complex health challenges like hormonal imbalances, chronic fatigue, weight changes, and mood disorders. Dr. Duffy's experience and expertise in functional and integrative medicine is recognized on a national scale as she is frequently a guest on ABC, NBC, CBS, and Fox. She is known for her dedication to helping people thrive at every stage of life. Her mission is simple: to help individuals feel empowered, balanced, and in control of their health. Welcome to the show, Dr. Duffy. I have a special guest in front today, Dr. Aimee Duffy. We're in groups together. I've heard her speak. You've probably heard her speak on multiple news outlets. Welcome to the show, Dr. Duffy.
Thank you. This is so awesome, Rob. Thanks.
Yes, we've been chatting about getting this organized, but Dr. Duffy has an incredibly busy schedule with appearances and lectures, and she was just regaling me with a cruise slash business trip she was on recently, which sounds a lot more work than I am up for.
It was fun though too. We got to have fun while we're working. That's the bonus.
Well, certainly. And when you go back to Carolina, and Dr. Duffy has a wonderful practice in Carolina, and she's very interested in sharing both how she got started with that practice, and then, whether it's in-person care or virtual care or business coaching. She's going to explain to us how she's evolved and wants to move forward.
So everybody always asks, I'm a medical doctor, I'm family practice by trade. And, how did you get into this functional medicine, integrative medicine, hormone health path? And it goes way back to when I was little. I actually loved babies when I was little. I just wanted to hold every baby. I volunteered in the church nursery all the time. And I started babysitting when I was 11. And actually, I met this family at a pancake breakfast in the neighborhood, and they said, "Can you come babysit? Our baby just loves you." And I was like, "I don't know if I'm old enough to babysit," but I started just being, she called it a mother's helper, just come hang out and play with the baby so I could get some stuff done around the house. And so that relationship continued from 11 years old all the way through college. Actually, I'd go home in the summers and babysit for them. So when I was 17, senior in high school, they were having another baby and offered for me to be in the delivery room with them. So that was my first experience in sort of hospital, any kind of, medical procedure type stuff, particularly a delivery. And I just absolutely loved it. When I saw baby Joshua get put on mommy's belly, I was like, this is so cool. I want to do this. This is the job I want. And I thought I wanted to follow the baby, but I really wanted to be part of that whole birthing and delivery experience. Then I thought I wanted to be a midwife, and some smart person talked me out of that and said, just go to medical school. That's what you need to do. So college, medical school, residency, I did it. When I was in medical school, I had my first baby in third year of medical school. And so you're doing lots of rotations and trying to figure out third year and be pregnant the whole time. And not only are you tired from being on call and up 24 hours, also pregnant, moving towards that OB type practice, and thought I needed to do something that maybe was more calm, for lack of a better word. So when I did my family practice rotation, in the hospital, it's just very hardcore, like there's no time on the clock. You never stop. You experience that now, right? And then I got to family practice, and it's like, we all work hard, but this was my imagination. In the residency was like, we stroll in at 9 with our coffees, and then what time is lunch? And then, 4 p.m. there was like a lecture or something, and then you're done for the day unless you were on call and you stayed. And it just seemed like such a more hospitable environment than the hospital system. So I chose to do family practice, found a residency that was very heavy in the obstetrics. We did obstetrics for like the the indigent population in a small town here in South Carolina. So I delivered thousands of babies in my residency, got C-section privileges, like loved it. So that's really where I moved forward. Then I got an offer from the OBGYN office next door to join their practice to be primary care for women's health and then share OB call with them. And I thought I was in heaven. This was the best thing ever. And I was, except that I really didn't have very much like GYN training. We had about 2 weeks in family practice of, rotating with the GYN on, here's the samples in our closet of what you might use for hormone replacement or whatever the case was. So all these patients were dealing with what we thought or what they thought were hormone issues, whether it was menopause, whether it was perimenopause, irregular periods, mood stuff. You felt like you're a counselor, like you come in and they're just throwing all their stressors and not sleeping well and depressants and all that kind of stuff. And so I really felt inadequate. This was around the time that the Women's Health Initiative came out 25 years ago, telling us hormones were bad, right? So I'm over here going, how do I manage not wanting to kill people, but also take care of their symptoms, right?
Can you explain how bad that was?
It was awful, awful, awful. So this study came out and it was, 2 medications that are synthetic, Premarin and Prempro, for hormone replacement for postmenopausal women. Number one, the study was done on women that were way postmenopausal, like the average age was 65, 66. Menopause happens at 50. So, we were already well beyond menopause at that point. And we knew that these medications were very positive for bone health. A lot of women were on it just to protect their bones, basically from osteoporosis and menopause. But the study was actually scheduled to go on for years, and it got stopped early, about 3 to 4 years into it, because they saw an increased number of strokes, blood clots, and heart attacks, as well as breast cancer in these women, particularly on the side that had the Prem Pro, which is a synthetic progestin. And so they stopped the study. Basically, all the bells and whistles came out and said, hormones bad, we should all stop using them, not really recognizing that there are all different types of hormones, not just these two. But it really got a bad rap for the whole, hormone, menopause, hormone replacement world, that hormones were bad. And still to this day, I had a patient just yesterday who was like, I've talked to my GYN and they told me no hormones ever. Should I be on it for a fibroid? A fibroid. She had a hysterectomy because of fibroids and was told that she should never be on hormones. So, still to this day, and that's, part of our passion of getting out there and speaking is, one, we want to share the safety of hormones with our patients, but we want to help other practitioners understand that this crazy world of hormones being unsafe. I just spoke on hormonal decline and chronic disease and the relationship between the lack of our hormones like estrogen, progesterone, testosterone, and the increase of cardiovascular disease, of cancer, of osteoporosis, those sorts of things. And if we can replace these things naturally with topical bioidentical hormones, we can turn this ship around big time in terms of the chronic disease. So
pause there just for a minute, because, I'm relatively outspoken in general about what I do and the things that we see. And so when I venture down, and discuss this, I'm pretty careful with how I discuss this specifically as it relates to surgery, recovery, efficiency of recovery, communicate with my patients strongly that you have to, especially as a woman, avoid osteopenia, osteoporosis, fragility, frailty, doing things like spin workouts, HIIT workouts, high intensity intervals. These things are all not going to serve you in the long run. So I talk to them about walking, lifting weights, doing things that are going to preserve your muscle mass and avoid what we don't want, which is frailty or fragility, and you don't fall and break your hip. Like, let's just speak very plainly what we're talking about. Right. I don't want my patients falling down and breaking their flipping hip.
Yeah, the mortality rate for hip fracture is huge, and it's such a weird phenomenon, but it's just a pain in the butt too, to fall and break your hip, right? And usually it's a surgical intervention, but there's like a 12% mortality rate within a couple of years after breaking your hip, which is like higher than any other mortality rate for some other disease dysfunction. And people just don't put 2 and 2 together.
And I'll give you the real terrible, dirty aspect of this. That every woman listening to this, or when you share this, should listen to this. You know how how that happens, right? So we're going to say they don't listen to you or listen to another person who's more informed or informed about this, to the degree you are. They avoid replacement therapy. They're already osteopenic. That's standard. They may have leaky gut, all sorts of other things, live in a bad environment, drink out of plastic, just do all the things, right? Then they fall, or I'm sorry, first their spouse dies. So their husband dies. Their primary partner dies. So now they're alone, which is very common because women are alone more than men, right? Am I making that up? That's correct, right?
I don't know. Yeah.
All right. So this is what orthopedic surgeons used to tell me. I used to be an associate professor of orthopedic surgery. They would tell me like, hey, Rob, you know how this works is I'll get a call and they'll have found somebody sitting in their own poop for a week.
Yeah. Because they fell in the
Because somebody actually went into their home after not seeing them for a week, not a day, not 2 days, literally a week, because they've fallen. They have no device to alert anybody they've fallen. They don't have their phone on them. They can only scream so loud. They're already typically, as you know, as well as I do, malnourished. They're just frail.
Yeah.
And then now, what's your chance of survival? You've been sitting in your own poop with a fracture for a week and you're malnourished. Right now, you're even basically, you're on a hunger strike and your body's like, what the hell are you doing? I'm broken and you're not feeding me and you can't sleep. Like all the things that are necessary to help a surgeon who, no matter how technically gifted they are, can't overcome malnourishment.
Yeah. And there's not a whole lot in an IV you can do either at that point to load them up, right?
No, and they have to fix it.
Yeah.
So they're going to take you to a hospital. This poor little thing who fell and broke her leg, broke her hip, and they're going to basically, half the time, what they have to do is they have to replace the hip. So now you've got somebody who is not a surgical candidate to begin with, who's in an acute situation, who's malnourished, who's probably got no hormonal balance. Not a little hormonal imbalance, but no hormonal balance, like no testosterone. And that's what I tell people. Like, from my perspective, like when I see your labs, and as I've spoken about at our meetings, I look at free and total testosterone for a reason. And when somebody has like almost, and this is common, Aimee, undetectable free testosterone levels, they're like, can I have this? Can I have that? I'm like, no, we can give you some hormones, or Dr. Aimee can give you some hormones, but you're not getting surgery from me.
Yeah.
The surgery is not Harry Potter's magic wand of hormonal balance. Like, I am the biggest driver of cortisol you've ever met, Aimee. I make all your people look like nothing when it relates to how much cortisol I can cause because I operate on people for a living.
Yeah.
And if you have no hormonal balance, what do you think happens when Whitfield gets a hold of you in the operating room?
Well, again, that person probably, had a huge cortisol spike and probably had some adrenal dysfunction to begin with. We can get into that whole thing, but, now they don't have the ability with all the things you're talking about, nutrition, et cetera, hormones, but, cortisol is really important for the inflammatory process, healing, recovery, all that kind of stuff too. And they're probably tanked at that point with cortisol production. So
yeah. It's a really underappreciated how obviously people we look up to and admire for their approach to this, a very integrative approach where you blend what we know versus things that we should do better, whether it's nutrition or the quality of the things we put in, air quality, fluid quality, food quality, things that people just take for granted. Literally, I had a patient tell me this past week, you'll enjoy this. She comes in and she wants to have explant surgery with me. And I said, okay, I'm listening and, hearing the story. And she's like, I have ADHD. All of my kids have ADHD. And she's going on. And I'm like, so what do y'all eat? Just tell me like what's going on. And she's like, well, we got a lot of Monster, Red Bull, and C4 or something in the house, and the kids really like candy. And then I just kind of lost my mind. I was like, how old's your youngest kid? She said 7. I'm like, you give a 7-year-old Monster? First of all, that's not okay for you to drink. First of all, that's a non-starter for
no
me.
Human should,
you can't even be a patient of mine if you do that to yourself.
Yeah.
And so we gave them some, and I mentioned this because I think it's underappreciated because people don't know what choices to make because they haven't been instructed about what's good, what's not good. and they see all the stuff on TV or social media or whatever they're getting content from, however that looks. And so a 7-year-old doesn't know anything. What do they know? But if parents making a bad decision, then so I had to have an intervention, Dr. Aimee. I just basically said, okay, here's the deal. You cannot ever have any of those things in your house again if you want to be my patient. So you're going to take all that crap, all the soda, all the, I can't believe she's giving kids Monster, and what was the other thing I said? Red Bull.
Yeah.
And I was like, you got to take all that out of your house, and you can have, although this is not perfect, this is a bridge to just drinking like filtered water. I want you to drink Zevia. I know I don't support Zevia in any way or shape or form, but I'm just trying to give them a stepping stone to change a behavior.
Right.
Because now they've got everybody addicted to sugar and caffeine.
Yeah.
And then I said, you cannot give
ADD.
Yeah, you can't give kids who have ADHD Skittles and M&Ms and Red Bull and Monster. That doesn't work, right? That's first of all, those things have well over 100 milligrams of caffeine and too much sugar in them and all the things. So I said, there's this company called Human Chocolate, of which I have no relationship. It's just a chocolate company founded out of Austin that got sold. Anyway, like just give something better, like just a little bit better. And they don't have to have Skittles and Red Bull for breakfast. I mean, that's crazy. And then we have a restaurant here called The Well. So anytime you're in town, or anytime my patients come in town, this is where I send everybody. It's gluten-free, dairy-free, no seed oils.
Yeah.
And so people don't really understand there's a avenue to eat better, and it does taste great. You just, if you don't know that, as you know, and I know, you can't make decisions that are going to support your health and your family's health if you don't really have any kind of information.
Right.
And so it's a story that won't leave my head. It like plays on a loop in my brain all the time. And this lady saw me the other day. So she went and listened, which I give her full credit for. She listened. She didn't get turned off. And she went and she ate at the place I told her to. And I said, hey, I want you to take some tacos and some spaghetti bolognese home to your kids, because kids are all like, kid food is pasta and all the junk. Right. And I said, I guarantee you they will like it because it's really good. It tastes good, has all these natural flavors and ingredients. They're not processed by any means. They don't do that there. And so this is foundationally how you should eat. And you'll see behavioral changes in as little as a few days to a few weeks in your kids, because you're not giving them this crazy amount of caffeine and sugar, and you'll feel better too. And so, like, I know that we got off topic there, but like foundationally, people don't understand these very simple principles. And then, they look at me like I'm high as a kite when I start to explain them as a plastic surgeon. I'm like, Dr. Aimee knows I don't have to see or operate on anybody. I don't need that. I'm more than happy to tell you no, because when people aren't ready, I'm not going to make that better. So basically, I'd like to have 6 months to a year runway anyway to take care of anybody, so I can clean up the things I don't understand. So
in that elective surgery, although, breast implant illness isn't always elective, like once you find out that this might be something, stressing your system out, you want to get it out right away. But like you're saying, you've got to have a foundation that's ready for healing for a major surgery like that. And, I think that's a huge part of what we do is education. I mean, my patients watch up to 5 or 6 videos at least before they get in front of me, probably even more than that, So we're constantly talking about helping them understand the why behind what we're doing, whether it's nutrition. I mean, our wellness programs, very similar to yours, focus on nutrition, on toxins and detoxing your body, on gut health, on hormone balancing, on moving your body, fitness,
Right.
and then stress management mindset. Like, again, you can't have somebody come in with all these issues and think that there's going to be one thing, even hormone. People come in, oh, I need hormones. I'm having hot flashes. I need hormones. Absolutely. Right. You may need hormones, but we also need to deal with, hot flashes can be caused by blood sugar imbalance and insulin resistance. If you're drinking, a bottle of wine and margaritas all night long, and then you're having night sweats, it's not a hormone issue.
I'm glad you brought that up.
A dietary issue.
I'm glad you brought that up. So Aimee and I were both at different meetings recently, and I end up getting in this picture, and it's got Gary Burka, and it's got Chris Williamson and Jim Quick, Josh Axe, Ben Greenfield, Max Lugavere, and me, and Mark Sisson. Did I say Mark Sisson?
Oh, you didn't, but yeah.
Okay, so Mark's in the picture. For everybody listening, Mark I'm 55. Mark is 71.
Looks
Mark,
like
the most ripped person in the picture. I'm embarrassed, right? Mark is way fitter than me. And I'm like, what am I doing here? Like, I'm just looking like a slug, basically. And so I end up talking to Mark about his talk. He gave a talk about walking. So he sold Primal Kitchen. He founded a company called Paluva, which is a toe shoe. And I've worn toe shoes, Vibram, etc. I don't have any relationship to any of these companies. So just I don't get paid. Just
yeah.
so I'm just telling you. So I'd been told about Paluva for a while, but I get busy like you, and I'm like, stuff loses. I can't find it later on. And so I finally got a pair of Paluvas. I really like them. They're super comfortable to me. I now wear them to operate in because I get a lot, for everybody listening, like a surgeon, like I will stand in a position for multiple hours at a time, which is terrible for your neck and your back and your just overall. It's bad. It's cost me probably a lot of years on my spine. But so Mark gets up and gives this talk, and his talk is about, not just being barefoot, but the whole crux of the talk is the best exercise, the same exercise I tell everybody, the same thing Dr. Aimee just said was walking is a phenomenal exercise. And you can build both. You can do it alone. You can listen to stuff if you want. You can do it to build community. You can take your spouse, your partner, loved ones, your family, whatever, and you just walk. My wife loves to do this, Aimee. Like we went to Europe recently. I mean, she would walk for like days if I let her. Like she'd just wear me out because she didn't have feet that have stood in an operating room for almost, over 30 years now. So it's very different biomechanically for me. Like I can walk, but after several miles, I'm like, I'm tapped out. I got to get out of here and, sit down. But he gave this great talk about walking. So I'm going to have him on, our show just to discuss it because he's so well respected and he does such a good job about the presentation and why it's super important to walk and not do all these other crazy things like run and do crazy amounts of cycling and all this stuff that is
long endurance running. People think they need to go run miles and miles to be fit. Yeah.
And that's just dopamine release. Ultimately, that's all it is. You're just pouring out yourself for dopamine. That is it. You can eat.
I have his books in my office still, the Primal Blueprint and the cookbooks and stuff. We talk about it all the time. I mean, I use Caveman Day, examples when we talk about adrenals and as it relates to hormones. I talk about this with our younger female patients who can't figure out why their hormones are all messed up. Where's that coming from? And I'm like, that's all stress and adrenal, right? Like our body's number one job is to keep us alive first before we're ready to procreate. So if we're dealing with infertility, we're dealing with, women in their 30s or early 40s that are like, I think I'm going through menopause. Why is this happening early? And what I have observed in my practice is through testing, I do cortisol testing on everybody. The low progesterone happens early because our body's pushing it all towards staying alive and keeping that cortisol up because we're so stressed out all the time. We're funneling the pathway to more cortisol. So
Can
it's
you preface it?
progesterone down.
Can you preface it to those on and off birth control? Like, what are they experiencing that may be different? Because the birth control group is wildly.
Well, so there's two reasons someone's prescribed birth control. In my opinion, it's I need a contraceptive support because I don't want to have babies right now, right? So that's a separate entity, I guess, and that certainly can play a role too. I mean, and the hormones that are in birth control are generally synthetic hormones, and their job is basically to suppress your own hormones so that you're not ovulating. It can regulate your cycles, basically kind of shuts everything down.
Right.
So that's how it works and how it keeps you from getting pregnant because it keeps you from ovulating. What happens in our traditional medicine world is someone in their I'm talking, someone who may be done with birth. Let's say they're 42 and they've had a tubal or their husband had a vasectomy that they don't need contraception.
Okay.
Go to their doctor and they get put on birth control to control a symptom. I'm having irregular periods. I'm super moody during my cycle, something like that. It's just like, oh, well, let's just throw birth control on you.
It's so weird.
Yeah, it's not, birth control was created for contraception and not, hormone replacement to, Band-Aid a symptom that we can control.
Right.
But my point is, I talk about it from a caveman perspective is like, if our job is to survive from a female, we talk about libido, we can go on and on about all these different examples, right? It's like, if your cortisol level, and let's talk about that for a minute. Your adrenal glands make cortisol. You could also call that adrenaline to some degree. So when you're stressed out, you're a caveman, you're out walking, everything's nice, and you see saber-toothed tiger crouching over here, you're going to get this message from your brain that you better start running. We're going to run really fast. We're going to jump really high. We can lift heavy things out of the way. We sprain our ankle. We don't feel the pain. We got to run until we can hide in a cave,
Right.
outrun the tiger, hopefully survive, catch our breath for a little bit. The tiger gives up and goes off on their own. And then you go back to your village and you tell a story and you're like, cool, look what happened to me today, right? And life goes on. Well, we have things coming at us all the time that aren't quite the level of the adrenaline rush you need from a saber-toothed tiger, but we've got driving, we've got traffic, we've got, text messages coming in and work-related stuff and everything that's stimulating our brain to raise our cortisol initially. And our bodies were not meant to do that. So over time, your cortisol levels start to decline because your adrenals don't have all the ingredients it needs to make more and more and more cortisol all the time. And over time, then the brain goes, well, if you're not going to respond, I'm not going to listen. And so we get this suppression of cortisol over years and years of chronic stress. So a lot of people think their cortisol levels are going to be through the roof when we measure them, and they're actually low. So if back to this caveman analogy is like, you're going to stay in your cave because if you go out of that cave, you're not going to be able to run from the tiger. You don't have the ability to kick up that cortisol in order to run from the tiger. So it says stay in your cave, right? And then it says, if we can't make sure that this own body is going to survive, why in the world would we put a baby in there and hope that the baby is going to survive too? So infertility happens at that point. Libido, right, goes downhill because it's like we're not going to procreate if we got to worry about survival first. So everything gets shunted down to survival. And we don't realize that because we don't feel like our lives are in a state where we're trying to survive every day. Like we're not Hunger Games, we're not, something like that where the world's ending and we got to, carry our guns and our bows and arrows around everywhere. But this constant bombardment, we can go back to the food we were just talking about. I mean, that stuff that we put in our body is just as bad as the stimulation that we're getting from the outside world. So all those chemicals, all that sugar, all that caffeine, all of that stuff is a stressor to our internal environment as well. So, if you just, I know it sounds complicated, but it's really not. Like, it's very simple. Your body's trying to keep you alive, and it's going to do everything it can to stay alive. So it's going to not do normal stuff in order to shunt everything to staying alive, basically. So, that's really where we get to the basics of what do we eat? And that's why I go primal blueprint, right? Like, what did the cavemen do? Like? They didn't go package stuff and they didn't even really grow things, right? It's like, there was an apple or a nut or a berry, and then we ate some meat and
Right.
It happened.
And then if they couldn't find it, what did they do? They
walked.
were fasting and
they fasted or they walked, for a long time until they found something, right?
So I used to always ask that question, Aimee. I'm sure you've done this too. I'm like, I would ask people, I'm like, do you feel better if you're fasting or have not eaten? And they're like, oh yeah. And then I eat and I don't feel good. I'm like, there's your answer, right? What you're putting in, your body's like, it's not.
Unless they ate Skittles and Monster and then they feel like crap 2 hours later. And so then they get grouchy and they got to go find more,
Right. Yeah. Those
food to fulfill
those choices, when I had problems with a little bit, because I have non-celiac gluten sensitivity. And before I knew it, I always felt better if I was fasting for obvious reasons, because I just didn't know when I ate things, like what was going to happen. Obviously now I'm very intentional, and I mostly have just like, I like protein and I eat a lot of fruit, and that's how I get fiber. And that totally suits me. I'm super happy. I went to dinner at the place I told you about, the Well, and in my neighborhood in Westlake Hills. And I don't necessarily have a what you would consider the entree on any menu. Like if I just want to have protein, I get a couple sides of salmon, or I'll get a couple sides of Wagyu, and that's what I'll eat. And people look at me like, you're not getting a vegetable. No, I just get what I want. I don't get what you think you want or what you think you need. I just eat intentionally on how I want to eat. Like, don't project your nonsense on me. That's not okay. And, at this place that I frequent all the time, And, they got great bone broth. And sometimes I'll, if I'm feeling it, I'll get some vegetables put in it. Most of the time I don't. I just don't. It's not my thing. That's it.
Well, we often go to restaurants. I mean, I'm gonna throw Mexican out there. You got Tex-Mex everywhere, and like, you start the meal with your chips and salsa and your margarita, and like you've got, more carbs in the snack, before your meal even came than you should eat in 3 days. So, yeah,
And people come visit Austin and they want to go have Tex-Mex. And I'm like, no, I'll send you to this place. You can get some tacos, but I don't want you eating Tex-Mex. And this is not the time to go have sushi. You're going to have surgery. Like, this is not, you're not going on a Michelin star retreat here. So you get sick from eating a bunch of stuff.
Well, and I think people get scared of fasting a little bit because they feel like it's so extreme and what, am I going to get hungry and all that kind of stuff. And we're not talking about doing a 12-day fast, even a 3-day fast. Like, you're just talking about don't eat breakfast, right? Or like, it doesn't have to be quite
the master cleanse or anything.
And it can also be, again, like you're saying, just fasting from the things that we don't need to be putting in our body. So it doesn't mean you have to be on a complete calorie deficit, but how about fast from sugar? How about fast from, those complex carbohydrates, the gluten, the bread, that kind of stuff. So you can fast without it being this scary,
I'm glad you brought that up.
Just withering away.
Bread freaks people out when I tell them not to do that. So there's a company called It's All Good, and they have this great sourdough product they deliver to us now because that's what they use at the restaurant we go to. And it's really good. And I don't, I'll go out on a limb and say, we try to avoid, seed oils. We use like avocado and we use olive oil. And then I like grass-fed butter. I don't care if you don't like it or not. I like grass-fed butter and I like it on my sourdough bread. That's what I do.
Yeah.
That's what I like.
When you're going to indulge in something like that, then again, make sure that we're getting the right ingredients and the right sources. And there's so much out there now that we have available to us that we didn't used to have,
Yeah. I mean, so I like ghee and some grass-fed butter. Big whoop. I mean, that's my choice. I feel like that suits me best. And that's, if I'm trying to help guide people along, I'll try to get some subs in there, what they cook with and what they use just to create more of a lower inflammatory burden for them. And that's the perspective and lens, like I'm sure you and I both approach similarly.
Absolutely. I mean, again, it's just what can we get from nature that doesn't have to be too messed with, and I think we did, not only did we do a huge disservice and hormones are bad, but we did a huge disservice in the low fat craze, right? So, everybody starts to want to eat healthier and they immediately go, I've been eating low fat cottage cheese and like
I lived through that with my mom.
Whatever. Yeah. I mean, just, everything low fat, low carb, all packaged stuff, even gluten-free. I have a little bit of, nail biting on the chalkboard. Like, I eat everything gluten-free and it's like all packaged stuff, right? So just because it says it's gluten-free doesn't mean it's healthy. And in fact, you go to, something like Mellow Mushroom, we have it in our parking lot, basically in my office. And so, everybody wants to go to Mellow Mushroom. Well, their gluten-free pizza has more sugar and more carbs in it than their regular pizza does. Yeah. So, just because it's gluten-free doesn't always mean it's healthier. So, I have a hard time helping people find substitutes for things, and just kind of say, let's just, stick to the basics. What's your protein? What's your source of fiber? So whether it's veggie, whether it's fruit, then that's about it. Like we don't, and then what's your fat, right? So whether it's seed oil, non-seed oils or whatever, healthier type stuff, love grass-fed butter, love real dairy, that kind of thing. And not being afraid of eating fat because this whole low fat thing is so crazy.
Yeah. It's been debunked. And I met Asim Malhotra, Dr. Malhotra from the UK. He is the guy who came out and said, there's nothing wrong with butter. As a cardiologist, which obviously got him in a bunch of eyeballs on him. And I mean, it's like anything, that whole low fat and, trying to be careful and having really the wrong, perspective. Dr. Malhotra is also the person who described how simvastatin, the statins, are so bad for you. And, that's Dr. Aimee, when there's so much money involved, this information, whether it's from the food industry, the pharma industry, whatever, there's.
Yeah, I mean, they want to get it in front of our faces any way we can. So, scaring people is a good way to get people to change their behavior too. So, what we can relate. I mean, I relate everything back to hormones. I just again had a patient whose cholesterol came down after working with me for 6 months, and she said, "Well, what did we do to work on my cholesterol?" Or what was the thing, and so, she's like wanting to know what supplement she needs to stay on because her cholesterol got better, right? And I'm like, okay, well, let's talk about all the things that affect your cholesterol. But part of it is hormones. I mean, she came into me again, undetectable hormones. She's like 63. So, of course, we replace her hormones, and I'm a very visual person. I have a screen in my office, and so I'm pulling up the hormone cascade, and I just love it. I mean, I do this every day, and I'm like, I got C's in biochemistry in both medical school and in college. I got C's in biochemistry, like absolutely hated biochemistry. And I'm like, every day I have the steroid hormone cascade on my screen. I'm like, I'm doing biochemistry, like, but when you explain it with pictures and not all the actual biochemistry of the molecules, but all of our hormones are made from cholesterol as their base. And so, cholesterol
Intrinsically
around there. And when our hormones go away and our body's like, we kind of liked those, like they were helpful. Can we make more? So you get this feedback loop that increases your cholesterol to potentially make more hormones, but then the ovaries and the testes and the pituitary aren't making the signals to turn that cholesterol into hormones anymore because we're done procreating at age 50. And so that those signals go away, right? So low hormones get us higher cholesterol. We see it in both women and men, probably more intense in men, I think, with low testosterone for sure. And then if you follow up with that, when you replace these hormones, you see cholesterol go down, you see inflammation go down. All of our hormones are anti-inflammatory, for multiple reasons, whether it's at the joint, again, in surgical world, like, you get somebody who's got tapped in hormones that are at their best place, their skin, their collagen, everything is going to be so much more viable and supportive when we get to that place. So
Absolutely. When I know this is going to be a little controversial, but somebody who shows up and has a slightly elevated total cholesterol level, and they ask me like, do I need to be on a statin or something? I'm like, hell no, you don't need to be on a statin. Just calm down. There's very specific things that we're not going to go into about, what the ratios and specific things in terms of HDL and LDL and all the things, but I don't even pay attention to those things, honestly. Now, if you had a wildly elevated triglyceride level, yeah, we'd have a chat about that because that's going to get you into
that's probably insulin resistance, right? So, I mean,
exactly, but that deserves a chat.
Not just cholesterol, right? Yeah,
right. That deserves a bigger discussion. When somebody's got, depending on when you checked mine or whatever, I may have an elevated total cholesterol. So what? Who cares?
Well, yeah, and in this integrative functional medicine world, like we go way in depth. Like we're looking at, like you said, the ratios. We're looking at sticky factors. We're looking at plaque activity. So the maybe handful of times that I can count that I've prescribed a statin for a short period of time in a brand new patient that comes in is, and they don't have to have high cholesterol. So 50% of people who have heart attacks have normal cholesterol.
Right.
So, you've got to look deeper at it. May not just be a total cholesterol issue, but if they have a marker that we can measure called plaque activity, and if that plaque activity is high, the benefit of statins is to stabilize plaque at that moment, right? So we don't want to be on statins forever to, quote, lower our cholesterol. We actually want to stabilize that plaque. So I will put somebody on a low dose rosuvastatin, which is the healthiest one that we can at least make better choices, right? For, about 4 to 6 months or so while we're getting all this other stuff worked out. And then, once we know we've seen all the other things that could create this cholesterol and this inflammatory process to happen, we've recovered and repaired those issues, then we can come off the statin.
Yeah, and you're talking about a very, specific indication for
Right,
using
right.
the medications.
And I just use an example as, we don't, again, you're not going to just look at total cholesterol and prescribe. Like there's so many other reasons to go into it.
Yeah, for everybody listening, Dr. Aimee's giving you her very specific approach in a set of patients that she sees, but on the majority of the people she sees, she's never going to put anybody on a statin. It's going to be very nuanced in how she approaches it versus, oh, here you go. Your cholesterol's elevated. See me in 6 months and we'll, recheck it without any, I don't want to say this in a negative way. The hardest thing always is to change somebody's behavior, their habits, their lifestyle choices. And although Dr. Aimee knows this, nobody gets paid for preventative care. And that's, basically what we're talking about is, trying to, I always say prepare rather than react because I operate for a living and
Right.
Dr. Aimee's trying to prevent you from getting sicker and sicker and sicker. And that's our goals are not to react to all the things with medications.
Well, and if you use medications to Band-Aid things, then you're reacting like you said, but you're not fixing the underlying reasons why these things happen in the first place. So, you can go Band-Aid with 5, 6, 10 different medications, but the real reason why high cholesterol is happening or inflammation's happening or whatever isn't being addressed, whether it's hormones, whether it's gut, it's probably a combination of both. We talk about things that are layering up to fill up your bucket. It's not going to be one thing that we're magically going to do. And that's why it's so important to find somebody who addresses all of these things.
Right. I have a patient in the city from Europe, right? Or I'm sorry, in Austin from Europe I've operated on. And you don't travel from Europe to have just the surgery.
Right.
So a lot of competent surgeons all over the world. You don't need to come to Austin for surgery. It's really about our programming and, the content we've produced that resonates with patients just like your patients, and they want to engage in somebody who's trying to treat and take care of all of it at one time versus maybe farm it out to different, subspecialists or providers of whatever, care. And I feel that's obviously the big differentiator for us. And, we have hyperbaric in our office. We have things that help with grounding that are very intentional, like the human regenerator. We have red light therapy. We have NANDV therapy. And I would be remiss. Like, I think an underappreciated thing is lymphatic decompressive massage.
Mm-hmm.
And we have these devices from New Zealand called Filipresso. And they're really very, very efficient in improving lymphatic drainage, but they're also helping get you in a more parasympathetic state and help even with a little bit of warming on the trunk area, which helps get people into a more parasympathetic state. So trying to get people out of the fight or flight, out of the high cortisol state after surgery as quickly as possible is one of my main tasks.
I want to come there. I don't need surgery, I don't think yet, hopefully knock on wood, but I want to come there just to hang out and get all the things.
And that's part of, basically that's, that's the situation. I've done several thousand, explant surgeries, and my gosh, I've been operating for next year, it'll be 30 years, which seems crazy. I'm now operating on people that that are born the same year I graduated high school, which is just doesn't sit right with me, honestly. It's just kind of weird.
What happens when our kids get older, right? You keep looking at the age. I'm like, wait a minute.
Yeah.
You're now the same age I was when I had you, like that. I can't.
It's just weird. I gotta somehow, sort that. I don't know if that'll ever work out for me.
We were talking, I'm going to go back for a second to the very beginning of our conversation. We we're talking about bone health and hormones and things like that, and how, we want to prevent fracture for sure. But one of the things I love, and your listeners may know Tina Moore, and I think she's awesome, Dr. Tina, right? And I just remember hearing, her talk, and she's so funny, but she's like, I want to bounce and not break, right? So like, you're gonna fall. Like we can try to prevent falling all day long, but hopefully you're out hiking and you trip over a stump or something like that, right? But we're going to fall at some point. But can we be in this place where our body, our bones, our musculature, everything, our core is stable enough that it's going to catch us. And so we're just going to bounce right back up again, and we might get a scrape on our knee or something like that, but off we go, and we're going to bounce and not fall, right? So when we think about all these preventative things that we can do, if we're adding stuff to our diet that's stressing our system out, it's not getting us the nutrition, then our gut's not happy and we're not absorbing. But hormones play a huge role in supporting your bone health, so they stay strong, your muscles stay strong. And when we think about exercise, like we're talking about walking, which is absolutely important, but some of the things that people don't even do is like, they don't get down on the ground and just try to get back up again. Like,
Right.
it's an exercise you can do. I mean, it seems silly, but it's just like people go, "Oh, I'm not going to get on the floor. I may not get back up." Well, maybe you should try that. Like,
Right.
have somebody there that can help you get back up if you functionally can't do it yet, but like just get down and get back up again, because if you do fall, you can prepare yourself for that so we can get up again.
Yeah, it's all about, you're discussing and kind of, when I speak about, being frail, but you're kind of, the undertone is just being resilient, making sure you're taking care of yourself in a way that makes you resilient. So if something happens, you can resolve it. You can push you fall down.
And I think our world, it sounds a little like prepper, right? But you should be prepper for your body to some degree. And I think what happens is we are reactive. Like people don't do anything until something happens, right? Until I get the diagnosis, I get sick, I get the fracture. Then it's like, oh, what do I need to do to, heal my bones? Let's start now with like thinking about what can we prep for, to make sure that. And if you're doing that, you're really doing what we call anti-aging, right? We use this term longevity, anti-aging, all these things is like, let's keep our bodies from getting to that frail state. So, we can not only live longer, but we want to live optimally. So, we don't want to live longer in a nursing home. We want to live long and still be active and fit and doing all the things we love, especially when we get old and have grandkids.
Well, I think Dr. Aimee and I share a lot of core principles that are relatively in alignment. And if you want to learn more and become a patient of hers, or if you're a business looking to learn from her, I'm going to let her share her contact information and we'll close that way. But I really appreciate her coming on my show.
Yeah, this was great. So you can reach me at carolinaintegrativemedicine.com. That's my practice in Clemson, South Carolina. And if you're interested, if you're a practitioner or somebody looking for some more support in how to run your business from a coaching perspective, Aimee Duffy, MD, is my website for business coaching or personal speaking engagements, that sort of thing. So that's how you can find me. And I'm on all Facebook, Twitter, all that kind of stuff. You can find me.
She's in all the places. Look for her. Thanks again for coming on the show.
Thanks, Rob. We'll see you soon.